Many people in Tampa Bay suffer from fibromyalgia and may not know where to turn to for relief. Well, today, Dr. Rudy Gary from Florida Pain Relief Group is here to tell us how they may be able to help. Good morning. Welcome back.
Thank you.
This is so interesting talking about fibromyalgia because I think it's changed so much over the years. We're maybe learning a little bit more about what it is. Kind of let's start there. How do you best describe what it is, fibromyalgia?
Sure. So fibromyalgia has evolved throughout the years. You know, it used to be that we had patients coming in and we just didn't know. You know, we didn't know what was causing all these aches and pains. And unfortunately, some patients were actually, incorrectly labeled as, hey, it's got to be in your head and that kind of things. You know, and we now know that that is a real illness. We know that it has characteristics and that exists. So it's not in your head. You know, typically you feel a lot of these aches and pains. It's called fibromyalgia because myalgia is the Latin term for muscles, and fibro means your fibrous tissue. So normally it's you feel a lot of what we like to call trigger points, these little knots, these little nodules that form inside your muscles. They get very, very painful. It's almost like mini Charlie horses. Ugh. And we tend to get that throughout the body and throughout your muscles. Is it in one muscle more than another? I mean, is it in our legs typically more? I mean, where are you seeing it in patients' bodies? We tend to see it mostly where there's a lot of tension. So, for example, in the neck and the shoulders, behind the shoulders, but really it can affect just about anywhere in your body, especially wherever you have muscles, which is the entire body. Well, the good news is now that we're learning and understanding a little bit better, I'd imagine that the treatment options are kind of going in that direction as well, or at least I hope they are. Yes. What say you, doctor? So we've actually gotten much better at the treatment options for fibromyalgia, and that can vary anywhere from physical therapy. Sometimes just massage therapy can help out. Really? Medications. We can even, if it gets really bad, I've seen patients come in, with tremendous amounts of pain, almost they're crying because they have so much of those little tightness. And what we can do is a very tiny needle. We can actually inject a local anesthetic and a small amount of medication to actually relieve those very tight nodules, and it's very gratifying when you see a patient walk out of your office. They come in, you can see their face, and then they're smiling afterwards. Oh, I can imagine. Is this hereditary, or do we see it more in men or women, or is there anyone that's... Unfortunately, it does have a bias for females. Okay. We don't really know the reason why, but women tend to be affected with fibromyalgia more than men. Okay. We see that a large majority of our patients are females. Do you feel hopeful that we'll learn even more about it? Are we getting closer to maybe even kind of finding more causes that much sooner? I'm excited. Okay. Medicine is so dynamic. It's so unique. We learn different things every single day. And, I can't wait. We keep finding cures for a lot, and in medicine we won't stop until we find that. But until then, there's a lot of treatments that we can do for it. So if someone's watching this morning, maybe they or someone they know is suffering, what would you have them do? Well, what they can do is, if they've gone to the primary care doctor, they can the doctor can refer them to us, or they can call us directly, and we'll be happy to take care of them. First step, a consultation to kind of see what's going on, where they're hurting, what's going on. Yeah. So when the patient comes in, we're going to perform a thorough history, an examination, review medical records, try to make a diagnosis, because we want to make sure that it really is fibromyalgia, maybe not, something else going on. Right. Awesome. Doctor, thank you so much for being here. As always, we look forward to having you back. There is the number to call to find out more, and then also their website as well.